Hi, I'm Dr. Benga Drojai, consultant family physician and geriatrician. I'm continuing with the series on Salmonella typhi or typhoid fever. Like I told you, it's caused by the organism called Salmonella typhi because it has a flagella, something that helps it to move around the body, and it is transmitted through the fecal-oral route. That is when we ingest food or water contaminated by the organism. So it enters into our intestinal tract and then penetrates through the mucosa or the lining of the intestine, enters into the bloodstream. From there it goes into the liver and then into what we call the biliary tract, where bile is secreted. That is where it actually multiplies and then re-enters into the bloodstream, enters through the intestinal tract, goes for the lymphoid tissue, which is at the what we call the Peyer's patches at the right lower abdominal side, and then it multiplies there, and then it begins to cause illnesses and diseases. The features of those illnesses, it could include fever, so high-grade fever, body pains, joint pains. But one unique thing about typhoid, and that is why I correct people when they say, oh, I was diagnosed with typhoid and malaria. Almost all of the times, typhoid fever will come with abdominal symptoms. And so the person could have a constipation that will now be followed by episodes of diarrhea. There's usually abdominal pain and then passage of loose stools, which could be foul smelling. It could also be mucoid in nature. And so the person might have fever, he might even think it's malaria. And that is why it's important to run some diagnostic tests and not just treat everything as having typhoid. So headache is not just when you have a headache, it doesn't mean what you have is typhoid fever. When you have joint pains and all of those things, it could be other infections. It could be a viral infection, and that is why it is important to run a diagnostic test. Always remember, your health is king. I offer health for kings. Make sure you wash your hands well. Always maintain your hand hygiene so you don't spread Salmonella typhi and spread infection of typhoid fever. Thank you so much. Have a nice day. Bye.